Hi, I'm Sheena Patel, pelvic health physiotherapist working at the Great Western Hospital in Swindon. Today, I'm going to talk you through some important information that will help you look after your pelvic floor whilst pregnant. The aims of the session are to learn about the pelvic floor, recognise signs and symptoms of pelvic floor dysfunction, and how to manage these issues should you experience them. I will talk you through some topics that will help you during your pregnancy, including the pelvic floor, bowel and bladder care, perineal massage, as well as how to look after your pelvic floor and pelvic health after delivery. So, why is your pelvic floor so important? Well, there are many reasons that can lead to pelvic health dysfunction. One of the biggest factors for pelvic health dysfunction is pregnancy and childbirth, which is why we have created this workshop for you. During childbirth, sometimes it is necessary for us to need assistance by the use of forceps or ventouses. Other factors which can also put you at risk for pelvic floor dysfunction include obesity, constipation, multiple births, increased age, and smoking. You may not be suffering from any symptoms now, but may later during the pregnancy or after childbirth. Therefore, it is vital to have the confidence and the knowledge to know how to prevent these symptoms if you experience them. So here are some facts to get you thinking. 1 in 3 women will develop urinary incontinence. This is leakage of some kind, such as urgency, stress incontinence, functional incontinence, and overflow. 1 in 4 women will develop fecal incontinence, which is the inability to control bowel movements. And 1 in 12 women will develop pelvic organ prolapse. This is when your pelvic floor is unable to support the organs such as the bladder, the uterus, bowel, and therefore these can move downwards, outwards, or protrude from the vagina or the anus. The pelvic floor consists of layers of muscle and ligaments that stretch from the pubic bone to the end of the backbone and from side to side. As you can see from the diagram, the pelvic floor muscles act like a hammock to encompass the pelvic organs. On the diagram, the picture with the baby demonstrates this well. Firm supportive pelvic floor muscles will help support the bladder, womb, bowel, and close the bladder outlet and back passage. The pelvic floor is designed to support the pelvic organs as mentioned previously. The muscles wrap around the openings of the pelvic organs, for example, the urethra, otherwise known as the neck of the bladder, the vagina from the uterus, and the anus from the bowel. This wrapping around of the structures will prevent leakage. Keeping these muscles strong will improve your sexual function, as the antenatal process can weaken the pelvic floor, which may affect your sexual experience and your ability to orgasm. This diagram shows you where the pelvic organs are situated within the pelvis. Symptoms of pelvic floor dysfunction are as follows: urinary incontinence, urinary urgency, urinary frequency, fecal leakage, pelvic organ prolapse, and painful intercourse. These symptoms can occur at any point. Some women may experience these symptoms antenatally or postnatally. Women can experience one or more of these symptoms shown on the screen. All of these symptoms are preventable and treatable by carrying out pelvic floor exercises regularly and effectively. Urinary incontinence can cause leakage on coughing, laughing, sneezing, or on activity of some kind without warning, otherwise known as stress incontinence. Urge incontinence is when you have a sudden, intense urge to urinate followed by an involuntary loss of urine, and you may need to urinate often, including throughout the night. On average, a healthy person may need to urinate between 5 to 8 times per day, and they shouldn't need to urinate at night unless they have an infection, have a medical condition, or like you, may be pregnant. Overflow incontinence, which you may experience, is a frequent or constant dribbling of urine due to a bladder that doesn't empty completely. Fecal incontinence can include symptoms such as the inability to hold wind, urgency, or the inability to hold your stools. Pelvic organ prolapse can present as a heavy dragging sensation in the vagina, or you may feel some kind of soft tissue at the vaginal opening whilst washing down below. Often, women report a heavy dragging sensation at the end of the day or after an intense form of activity. Painful intercourse is an indication that your pelvic floor needs a health professional to assess you. There are many risk factors which can lead to any one of these pelvic floor symptoms mentioned on the previous slide. The aging process causes our tissues to weaken, which can or may lead to pelvic floor dysfunctions developing. Excess pressure on the pelvic floor tissues caused by chronic constipation, coughing, obesity, previous pregnancies or births will stretch and apply extra loading on the tissues, which can damage or weaken the pelvic floor complex. Perimenopause, menopausal changes which can occur from a gradual or significant drop in estrogen. A drop in this hormone causes your pelvic floor muscles to thin, therefore reducing the amount of support the pelvic floor can provide the pelvic organs. This can lead to the pelvic floor dysfunctions mentioned in the previous slide. Trauma is also a risk factor. For example, sustaining multiple vaginal tears or surgeries in the pelvic area can lead to some form of dysfunction. And other medical conditions can also cause or be risk factors, especially those involving connective tissues within the body can also weaken the pelvic floor. Now that you know how important your pelvic floor muscles are, let's learn how to do them. Pause the workshop video, click on the link to watch the video on how to do your pelvic floor exercises, and I will see you back here in 5 minutes. Pelvic floor exercises should be completed 3 times a day. It sounds like a lot, but I promise you it's not. Both the long and short exercises should be carried out daily. NICE guidelines recommends that we complete the exercises by doing 10 repetitions of each of the long and the short squeezes 3 times a day. NICE guidelines will ask you to hold the long exercises for up to 10 seconds. If you have ever done these exercises or are further along in your pregnancy, you may find it difficult to do 10 squeezes with 10-second holds. That's okay, so don't panic. Start the exercises slowly and work up to 10 squeezes and work up to holding your pelvic floor muscle for 10 seconds. Remember, focus on squeezing your back passage and then lifting up towards your pubic bone. If you are finding it difficult, think about completing these exercises in a different position, such as lying down, to make the exercises easier for you to strengthen up your pelvic floor exercises, and when ready, progress to a seated position. So, as previously mentioned, the fast exercises and the slow exercises are both a must. For the fast exercises, lift your back passage and let go rapidly. These exercises should be quick and snappy. Repeat this exercise 8 to 10 times. For the slow hold exercises, lift up your back passage and hold the pelvic floor for a count of 5 to 10 seconds, and then let go and let the pelvic floor rest for 4 seconds, and repeat this in a cyclic manner. It is important to fully let go your pelvic floor muscles during the rest phase. Bowel care. Constipation during the antenatal period and beyond is a risk factor for pelvic floor dysfunction, as previously mentioned. During the antenatal period, our body is working harder than ever. Therefore, it is important to keep our fluid intake up, especially to prevent bowel issues such as constipation. You should aim to increase your fluid intake to 1.5 to 2 litres per day to maintain a healthy bowel habit. It is important that you're ingesting enough fibre in your diet on a daily basis when you're pregnant and beyond. Look at your daily intake and see if you can change from white bread to wholemeal or seeded breads. Think about eating high fibre cereals such as fruit and fibre, Weetabix, shredded wheat, or porridge with chia seeds and flax seeds. Aim to take in about 5 portions of fruit and veg as recommended to help your bowels moving well during the pregnancy. As often during the antenatal period, it is common for the bowels to slow down due to pregnancy hormones. These can make your stools move more slowly through the intestines. Additionally, the growing baby and the womb will be putting extra pressure on your intestines, slowing them down. And often women need to take iron as iron supplements, which can also constipate you. When you open your bowels, try to maintain a good posture as shown on the slide. Place a stool under your feet to elevate your knees above hip height. This will place the lower bowel into an optimal position, allowing the stools to pass much more easily. If you are struggling, please contact your midwife or GP for further medical advice. Bladder care. Bladder care is important. Keeping your bladder healthy during this antenatal period will help reduce urgency, frequency, and leakage of urine. Try to avoid caffeinated, carbonated, fizzy drinks, as these can irritate the bladder. We recommend finding alternatives that you may like, such as decaffeinated teas or coffees, or water infused with fruit. Aim to drink 1.5 to 2 litres of water per day, as previously mentioned, as not only is this good for your bowel, but also your bladder. This will keep your bladder happy and reduce the risk of urine infections and dehydration. Try to avoid poor bladder habits such as just-in-case wheeze, as this will promote the bladder to adopt a poor pattern and lead to more trips to the loo. Do not do your pelvic floor exercises on the toilet. Let your urine fall away naturally. Stopping mid-flow on a regular basis will teach the bladder poor bladder habits, such as not to fully empty when urinating. This will lead to an increase of frequency of urination, incomplete emptying of the bladder, and potentially lead to urine infections. Perineal massage. So why do we do it? Perineal massage has been found to reduce the risk of vaginal tissue tearing during childbirth. The stretches shown on the slide can prepare you for the sensation of childbirth. Perineal massage should only be done from 35 weeks antenatally. It is recommended that the perineal massage is done 2 to 3 times per week to see the benefits of the technique. Before you try this at home, ensure you're in a calm environment, ensure your hands have been thoroughly washed before you begin, and choose a lubrication of your choice, and choose one of the 4 positions shown on the screen. Relax and start the massage. Taking some deep breaths might help you relax. Put your thumbs about 2.5 to 4 centimeters inside the back wall of your vagina. You might find it easier to use a mirror for the first few times. Press down towards your anus and out to the sides. You should feel a bit of stretching. You can hold this stretch for 1 to 2 minutes or do what you find comfortable. Then gently massage the lower part of the vagina for around 2 to 3 minutes, focusing on relaxing your perineum. Massage using your thumbs upwards and outwards and then back into a U-shaped movement. You could practice your slow, deep breathing techniques while you do this. Repeat this 2 to 3 times. Some people will focus the massage on previous scar tissue, which they may have sustained from previous tears or episiotomies. Perineal massage shouldn't hurt, though you may feel a pressure in the first few weeks of starting, which will ease. Pelvic girdle pain. Pelvic girdle pain is an umbrella term to encompass the areas of pain shown on the diagram. The pelvic girdle is a ring of bones around your body at the base of your spine. Pelvic girdle pain is in the front and or the back of your pelvis that can also affect other areas such as your hips and your thighs. It can affect the sacroiliac joints at the back or the pubic symphysis joint at the front. 1 in 5 women will experience pelvic girdle pain, and it can start as early as 8 weeks or much, much later. Remember, every pregnancy is different. However, the occurrence of pelvic girdle pain may increase the risk of developing it in subsequent pregnancies, but not always. After the birth of your baby, what to do? Here are a few tips to help you get through the first week or so to look after your perineum and pelvic floor. Pour water on your perineum whilst you wee to dilute the urine. Wash your perineum after opening your bowels. This will prevent infections. Change your pad regularly. Take regular pain relief. Use cold packs to relieve your pain, but do not apply it directly on the skin, as this can cause burns. Return to pelvic floor exercises as your pain allows. Once your catheter has been removed and you are able to empty your bladder normally, you can return to your exercises. Diastases. This is the separation of abdominal muscles. Some degree of separation is normal, and it usually resolves naturally postnatally. There are different types of diastases recti, as you can see in the picture. Postnatally, if you feel that your abdominal separation, that you have an abdominal separation, then please get in touch with your midwife to refer you down the physio pathway. I hope you have found this antenatal workshop useful. So, what to do now? I would recommend that you download the NHS Squeezy app and get started with your pelvic floor exercises if you haven't already started them. The app is a fabulous tool to remind you to complete your exercises the 3 times a day that we recommend, and it will guide you through your exercises. The NHS Squeezy app costs a one-off fee of £2.99. So in summary, these are the 5 things that we really want you to remember. 1. Complete pelvic floor exercises 3 to 5 times daily. 2. Avoid constipation as much as possible. 3. Aim to maintain a healthy weight. 4. Keep active throughout the pregnancy. And 5. Commence perineal massage from 34 or 35 weeks gestation. Thank you for listening to the information that we have put together for you. If you have any further questions or require any further assistance, please contact your midwife, health visitor or GP.